An unveiling worth millions, now leaving some to wonder what this investment means for those who helped to fund it. System leaders opened the Roy Blunt NextGen Precision Health Building today. Good evening, everyone. I'm Noah Klein. Thanks so much for joining us tonight. In our final installment of our series, The Push for Precision, we'll show you what running operations looks like for NextGen and what one influential precision health initiative in Indiana now sees 5 years out from its initial launch. KOMU 8's Avery Everett joins live outside the building now. So Avery, what does this mean for the people of Missouri?
System President Moon Choi says opening day here at NextGen means opportunity, not just for the university, but also for the state of Missouri. And it's an opportunity that's spreading across the nation. Opening day quickly turned into running operations for the Roy Blunt NextGen Precision Health Building. It comes just a few years after the System first push for initiative funding.
This institute will be in full swing with the research that's going on immunotherapy, radiopharmaceuticals, but we also have laboratories that are set aside to recruit.
The nearly $214 million institute is a research center for precision health projects. Now, what exactly is precision health? It looks at someone's genes, their environment, and their lifestyle to optimize treatment. Choi says the system approved about 50 faculty members for NextGen. MU Executive Vice Chancellor for Health Affairs Richard Barron says the institute could start seeing patients in the next 2 to 3 weeks.
They don't have to go to San Francisco or New York. They can come right here at the University of Missouri and be part of the NextGen enterprise and get taken care of right here.
A 5-hour drive and 2 states away. Indiana University precision health patient GINNY Mason says it's something she's been waiting for.
And the more places that are available for patients to get this kind of care, the better for them.
Doctors diagnosed GINNY with stage 3 breast cancer in the 90s. She eventually got treatment with what would become precision health. The treatment helped her push through, and now she's a fierce advocate.
I was told I had 12 to 18 months survival was my best case scenario. Obviously, I've blown those statistics out of the water.
Indiana University's Precision Health Initiative started 5 years ago. It started with conversations on cancer research and soon rolled out for other diseases.
I think increasingly people realize that there isn't a one-size-fits-all for almost any disease. Every disease, there are unique aspects. So every healthcare system has to get ready for this.
IU launched a $120 million initiative funded by the university in 2016. 5 years later, IU says it's a leader in the industry, with more than $400 million in research grants brought in. For IU's director of the Undiagnosed Rare Disease Clinic, Erin Conboy, it's all about the initiative's opportunities.
I'm honestly very lucky to be able to see these patients, help them, try to give them hope to find, to potentially find an underlying cause for what's going on.
Conboy says precision health is an opportunity, one that's tackling accessibility across the world for specialized treatment.
Sadly, your survival still depends on your zip code in our country and your access to care. And often, depending upon where you live and your financial status, you may not get the best care possible.
If everything goes right, this facility will be teaming with researchers, both faculty, staff, and students who are singularly focused on developing the next revolutionary steps to treat diseases using a very precise approach.
With only a handful of precision health initiatives across the United States, NextGen is opening up, and Missouri is taking that next step. NextGen's opening today is multiple years in the making. It's something President Choi has been calling the highest priority of the system since 2017. If you'd like to hear more from President Choi, I sat down with him in an interview on our streaming platforms like our website and on our Roku streaming app. You can see more of that extended interview. Reporting live in Columbia, I'm Avery Everett, KOMU 8 News.
Let's take a larger look here at this story. The initiative Precision Health will span across all 4 System campuses. Today's speakers at the unveiling ceremony said the goal of this new research center is to advance medical breakthroughs and stimulate the economy in the state with jobs and research grants. We caught up with System President Moon Choi after the event. He explained what this facility means for not just the MU campus, but the Mid-Missouri community as a whole.
When it comes to the economic impact of this facility, it was mentioned that over the next 20-25 years, the impact will be over $5 billion. And that's going to be an impact directly into this community. So we want that to continue.
Moon Choi added there were many challenges MU took on with this project before finally reaching today. He credited funding issues as one of those difficulties. Members of the Coalition of Graduate Workers protested outside NextGen Institute at its opening ceremony today. Graduate workers say their health is at risk after MU let its mask mandate expire last week. Members held up signs saying the university needs to reinstate the mandate for students who aren't vaccinated. The Coalition of Graduate Workers is a labor union with the goal to have a safer workplace and better pay. One member says he's already seen his classroom change since the mandate expired.
When I reported a class on Monday, I teach in a classroom that is much too small to socially distance in, and even though they said that students are encouraged to wear their masks, 2/3 of my students were not wearing their masks when I got to class.
An MU spokesperson says the decision to end the mandate was based on low numbers of COVID-19 cases at the university. He says the university